What is up everyone, Dr. Sheila Derm here and welcome to my channel. And in this video, I am going to be talking about Maskne, my derm tips and tricks and recommendations. And so let's get right into it. So Maskne is a trendy buzzword that kind of came to be for acne caused by wearing masks. Is it always acne? No, but that is the kind of most common form that we do see. I've also seen maskitis, which is irritation caused by wearing a mask, or a rash caused by wearing a mask. And in my practice, I live in the desert in Tucson, Arizona, and I've actually been seeing a lot of fungal acne around the mouth as well. And I know that was a huge trendy topic of discussion a couple months ago, and so I can get into that as well. So let's discuss what a lot of these skin lesions are that we're getting. And I've definitely suffered from acne or irritation from wearing a mask as well, especially because I have to wear N95s because I see patients. First tip is, because we're getting the irritation from the mask, I really like a lightweight, breathable mask. One that is still safe, so it has been shown to still prevent and help decrease risk of getting COVID-19. And so I really like the cotton mask, polyester mask, silk mask. And to be even a little safer, they have some that are cotton, silk, or satin on the inside, so it's really softer, and then polyester on the outside, which can actually help a little bit with the safety. And nowadays you can find really cute ones on Etsy. I have to wear my N95 because I see patients every day, and I'm like right in their face, checking them out or doing surgery or injecting them or doing something like that. And so you can find really, really cute ones. Usually when I'm out and about outside, that's when I'll wear my cloth masks. And so that's my first tip. It does decrease the risk of the irritation along here, which causes open skin, which bacteria and fungus can go in and cause problems. Tip number 2 is to decrease the face makeup, especially that liquid foundation. In this area, we really don't need it. No one's gonna see it. And so you can do amazing things with your eye makeup. I usually do my concealer, which I actually like the Tarte Shape Tape under the eye, and then I'll do mascara, a little bit of eyeliner, and then kind of do tinted sunscreen for everything else. I do have a sunscreen that is powder form that I can kind of get into in another video. But I really do recommend a lighter base, even a mineral base makeup if you do have acne and you have to get to work and then you have to take off your mask. And so actually I can do a come with me to Ulta or come with me to Sephora for my derm recommended acne prone skin makeup routines or what products I recommend. In fact, how about you click that notification bell so you don't miss that video. And while you're at it, click that subscribe button and comment below what specific products or what problems you guys have on your skin that you want to address with makeup. And so I can definitely include that in the video. So tip number 3 is to use a gentle detergent. This will kind of hit the bases of contact dermatitis, irritant contact dermatitis, as well as possible open, kind of microscopic open wounds that you could be getting that increases the exposure to acne, bacteria, and kind of that cascade of breaking out, because it's all kind of related together and intertwined together. And so I do recommend using a detergent that is for sensitive skin, one that is dye-free, paraben-free, fragrance-free. You could be tolerating the detergents that are for stains, heavy stains, the Oxy, Clear, whatever, for your body. But our face is much more sensitive. And so I've seen a lot of kind of allergies on the face from using these stronger detergents that really isn't meant for the face. And so definitely pick up, Free, All in Clear. Tide has one that is really for sensitive skin. And sometimes you can even just hand wash it. That's what I'll do sometimes. And you can literally dry it. And because they're so small, they'll just be dry overnight, which gets me to washing. I do recommend getting masks in almost bulk, like a few, like 7 to 10, because washing them is really important, especially if you get makeup transfer, especially if you have really dry skin. Now that we're getting into the winter months and you're getting kind of dry skin particles on there, that is a huge nidus for acne and folliculitis. And so if you have makeup transfer on there, wash it, one-time use. If you feel like, yeah, you didn't wear it the whole day here and there, I would definitely maybe wash it after 1 or 2 times. I would just have one different places. Nowadays, thankfully, we can find masks. They're readily available. Like I said, you can get some on Etsy that are super cute. even at like the grocery store. And so I do recommend washing them with a gentle cleanser and to decrease all of that. Just like we say, wash your pillowcases. You don't have to wash your you don't have to wash your pillowcase every day, but definitely weekly. So my next tip is to be gentle on your skin. Even if you're wearing a cotton or silk mask, you're getting these like micro abrasions that you may not see, but your skin is definitely dealing with a lot of these micro abrasions from wearing the masks that increase exposure again to the outside world, to bacteria, and to increase sensitivity to products that you could be using. And so I definitely recommend being gentle to your skin, which means decrease those exfoliants. I recommend a chemical exfoliant more than a mechanical exfoliant. Chemical exfoliants are like lactic acid, glycolic acid. I only recommend them like 1 to 2 times a week. I don't even recommend the mechanical exfoliants at this time because we're all getting those rubbing from wearing our masks daily. So put those aside if you can, unless you are really, really tolerating them well and you have a thicker, non-sensitive skin. So as far as kind of being gentle to your skin, I do recommend a good cream at night, a non-comedogenic one. You know, there's a lot of mask brands over the counter that are so great that I'm sure you guys have heard of. I don't recommend just one brand or one moisturizer or one face wash because everyone is so different. And I do skincare consultations because I'm a dermatologist in my office, and we spend like an hour going through every ingredient, everything they've used, because everyone has different skin. And so just because one product works for someone else doesn't mean that it works for you. But I do have, and I'll show you guys right now, my supply closet for my over-the-counter products that I give. And so I give a lot of those out to people and I have them try it, these little small sample sizes. I mean, as far as mask brands, I do like Cetaphil, CeraVe, Vanny Cream. Aveeno's been coming out with some great creams and moisturizers that are oatmeal based. That's very calming to the skin, especially if you have eczema or irritation, which my skin is like always, the eczema is always flaring. And so I can do a come with me to a drugstore and I can kind of go through these products as well. And I'll try to link down some products I recommend as well. And so you want to cream at night so your skin can renew while you're sleeping, because that is the time for your skin to regenerate and to become itself again, I guess you could say. And then in the morning, I do recommend a good light lotion, a moisturizing lotion with SPF. SPF is really important even under the mask because our mask is probably an SPF of, I don't know, like 3 to 5, maybe 3 to 8 at most. A shirt is 8. Darker skin tones is maybe like 5, SPF 5 to 8. So definitely recommend, especially if you have acne, because it's going to cause those post-acne marks, those post-inflammatory hyperpigmentation, and so you definitely want to make sure you're wearing sunscreen under your mask. So my next tip is active ingredients. So what I recommend over the counter, that one step before seeing your dermatologist if you are having that mild acne. So I do recommend a benzoyl peroxide in the morning. Benzoyl peroxide goes deep inside the pore to actually fight off that bacteria causing the acne, which is huge and Maskne right now. So that is mostly the reason why we're causing it. More stubborn acne, the hormonal acne, the deeper cysts, those need a little bit more intense evaluation. I go through the patient, but usually those need a little bit more prescription strength stuff. I do recommend zinc as well, and so I can talk about that in another video. And so benzoyl peroxide, love that in the morning, especially for those whiteheads, especially for Maskne. You can spot treat or use a wash. But definitely make sure you moisturize afterwards because they tend to be drying. And then at night, I do recommend a retinol or plant-based alternative for retinol is bakuchiol. This increases cell turnover, which helps those clogged kind of pores that causes those bumps that really don't come to a head, that are just there, because it increases that cell turnover so your pores are not getting clogged up. Added benefit, it also decreases those post-acne marks because of that mini peel effect at night. So those are my 2 go-tos. You could use salicylic acid, which actually helps that oil that's clogged up in the pore. But I wouldn't use like everything together. Everyone kind of has their favorite. I would say if you're going to use benzoyl peroxide, don't use the salicylic acid and vice versa. And then at night, you should only have one really active ingredient working on your acne, which I recommend a retinol. If you do need something a little bit stronger, you can come to my, go to your dermatologist, and we have higher strengths that are the tretinoins. Adapalene is also a really good one for acne, which is over the counter now. And so if your skin can't tolerate a retinol, adapalene really helps. It doesn't help as much for those post-acne marks, but it is a treatment that used to be prescription strength, and that's what I actually use for my acne, is adapalene, which is different, and then La Roche-Posay has one too. And lastly, if your acne is not getting better, you feel like you're getting more, or it quite doesn't look like acne, it probably isn't if you're doing all these things and it's not getting better, but it's maybe getting worse, or maybe it's hormonal, definitely book a visit to your dermatologist, and we can evaluate it. We can see what you've been using, what we're not using. You may need a little bit higher strength, or you just need it in like a specific order with your, we can coordinate with the other products that you're using. So hopefully those tips were really helpful in treating and preventing maskne. And so definitely keep wearing your masks, and don't worry, we can get through this. Bye guys.